Hello everyone. I am Dr. Karthik, consultant physician and diabetologist at Sri Lakshmi Multi-Speciality Hospital. So today I'll be giving overview of one of the most relevant and prevalent topic, that is diabetes mellitus. So as you all know, India is one of the diabetic capitals. So the overall prevalence of diabetes, which was around 7.1% in 2009, is about 8.9% in 2019, and it is said that approximately 25 million people, I mean adults, are suffering from diabetes mellitus. So, as you know, this is one of the most prevalent and more frequent conditions which we encounter day in and out. So, now what are the types of diabetes? So, basically, there are two types of diabetes, type 1 diabetes and type 2 diabetes. So, what is the difference? So, type 1 diabetes is the thing which happens in younger individuals, which is called as insulin dependent diabetes mellitus. So, basically, what happens in this, as you all know, insulin is produced by the beta cells of the pancreas, and in type 1 diabetes, the beta cells of the pancreas are completely damaged. So, these are the individuals who are entirely dependent on insulin for their maintenance or control of diabetes. This, as I said, usually happens in the younger individuals less than 20 years of age. And here there is no clear cut family history or genetical basis. Coming to the second type, that's the type 2 diabetes. So, this is the most common type of diabetes which we encounter in our clinical practice. So, type 2 diabetes mellitus has a strong genetical background, and here also there's a deficiency of insulin production, but not as much as type 1 diabetes mellitus. So, these are the individuals who can be managed with oral hypoglycemic drugs. So, this is called as non insulin dependent diabetes mellitus. So apart from these two main variants, there are other certain variants of diabetes called as MODY, LADA and all. But as for clinical practices, type 1 and type 2 diabetes are the most important ones. Now coming to the symptoms of diabetes. So if usually people ask me, does everybody with diabetes have symptoms? The answer is not really. So usually what happens is any person who is suffering from diabetes in the initial phases might not have any symptoms. But on a whole, what are the symptoms of diabetes? So usually the persons with diabetes, I mean when the sugar is little on the higher side, have symptoms like excessive thirst, dryness of mouth, excessive hunger, excessive urination, and unexplained weight loss. So these are the cardinal symptoms when a person who is having high sugars experience this. So, as I told again, not everybody with diabetes present to us with these symptoms. It's only few of them who have sugars on a higher range present to us with these symptoms. But for a general understanding, these are the symptoms. So, any person who has a strong family history of diabetes, who has unexplained weight loss, excessive urination, excessive fatigue, hunger, and thirst in increased amounts than unusual, they are the ones who immediately needs to check for the diabetes status. So this is the thing which everybody should keep in mind. Now coming to the what are the evaluation, how to proceed. So any person with a strong family history or incidentally detected to have high sugar or with the symptoms. So we check for the basic fasting sugar and after food sugars. And in individuals where the fasting and after food sugar show increased values, we do a test called as glycosylated hemoglobin. This glycosylated hemoglobin, commonly called as HbA1c, is a predictor of 3 months average sugar. So it tells what was your average sugar for the past 3 months. So it is given as percentage, so we can find out what was the person's average sugar for the last 3 months. So we try to correlate all. So one is the fasting, after food, and glycosylated hemoglobin. So if all the three are showing increasing values, or after food sugar is showing 200, or the person has symptoms, or the glycosylated hemoglobin is more than 7%. So these are the individuals whom we classify as diabetes who might require medications. So before I speak of medications, so let me just tell you about the lifestyle modifications of diabetes. So as I was telling, so diabetes, one of the mainstay of treatment apart from medication is lifestyle modification, which basically includes exercises and diet. Coming to the exercises, according to the latest guidelines from American Diabetes Association, any person who has diabetes, even a pre-diabetic individual, has to do compulsory walking for at least 25 to 35 minutes per day for at least 5 days a week. So this is the most important thing. Any person who is a pre-diabetic or diabetic has to compulsorily follow. Every day, at least half an hour of brisk walking for at least 5 days in a week is a mandatory for any person who has a pre-diabetic or who is a diabetic. So coming to the dietary modification. So basically, as you know, diabetes mellitus, I mean the sugar level in these cases are more because of the intake of carbohydrates. So one of the basic principles of diet management is to avoid carbohydrates. But carbohydrates is one of the important constituents of our nutrition. We can't completely do away with the carbohydrates, but definitely the carbohydrates percentage has to come down, which basically is rice and other carbohydrate related food. What the person can do is increase the protein intake, meanwhile reducing the carbohydrate content. So this is the mainstay of, the lifestyle modification. Coming to the medical management, medical management has both medications and insulin. So for a person who is recently newly detected diabetes, whose sugar is not very high, the HbA1c is on the mid to moderate range. These are the ones who can be initiated on oral hypoglycemic drugs, or any person who at presentation has significantly high sugar levels, extremely high glycosylated hemoglobin are the candidates who require insulin therapy. So, my sincere advice to a person who is suffering from symptoms of hyperglycemia, basically excessive thirst, hunger, urination, weight loss, with a significant family history, please check your sugar levels. If the sugar levels are high, please consult your nearest diabetologist or a physician. So, based upon their guidelines, we can see whether medications are required or not. Whatever is it, medications are required or not, whether you are in a pre-diabetic range, please do the lifestyle modification which has physical activities and diet. And in physical activities, apart from walking, which is usually recommended, you can also do little bit of yoga, pranayama, meditation, which also partially brings down your sugar levels. So these are the things which a person who is newly detected or a pre-diabetic definitely has to do. Thank you.